988, that is the number for the Guam Behavioral Health and Wellness Center's Suicide and Crisis Hotline. It's a support service for those experiencing mental hardship, especially in light of the Typhoon Mawar. I'm joined today by Director Therese Arriola with an update. Therese, I just wanted to ask you, with 988, did you experience an influx of calls, and if so, mainly for what assistance?
So, you would think we would, but unfortunately we didn't, and we are explaining that basically because of the communications concerns and communication, phone, WhatsApp, intermittent services that even after 9 days or 10 days after the typhoon, we're still experiencing. So we did not see a major increase. However, the calls we did get pre the 24th, which is the storm hit D-Day, was a lot of anxiety and stress. But during the storm and right after the storm, there's a lot of issues regarding loneliness, storm information update. So I just want to say thank you, Destiny, for getting out there, and I hope our media friends don't take this the wrong way, but the general consensus out there in the public is that there was a big media information void. Now, I know there was a lot of information to be shared because I received information from JIC, but the people of Guam weren't hearing it the traditional way on the radio, and we are so accustomed. I'm born in late 60s, so I've gone through many big storms, Pamela, Pongsongwa, Paka, Chataan, and now Mawar. And the one consistent thing you always know when you talk to folks is that they always heard somebody on the radio. There was a really big void of that. And so information was very difficult to get out, and with the issues of cell phone service and Wi-Fi, you were sending out messages, but you don't know when people got it.
Right.
So I'm glad that we're getting back to some normalcy. But yes, 988 is always here, and we've been up and running, and will continue to be up and running. But a lot of the storm, the calls that we did get prior to the storm is about anxiety of the upcoming storm. But now we're looking at needing more people wanting more information. Loneliness is really setting in, waiting for those services, FEMA services, to set up shop and actually start rebuilding their lives. And so my advice to folks is we all went through this traumatic storm here on the island, the biggest storm since for the past 20 years. So a lot of the younger generations have never felt a major storm.
Right.
Probably yourself. You don't remember, or you were just a little baby when it was Pangsangwa. So a lot of trauma, a lot of things that are natural for older generations like myself know what to do. It's not natural for the 20 and younger. So what I want to say to the people of Guam is 988, Guam Behavioral Health 988, Suicide and Crisis Hotline is here for you. You are not alone. Now that's very difficult, and I can say that very easily, but when cell phone service and Wi-Fi is intermittent and very sparse, that might be more difficult to contact us. But we ask you to do your best. Get on a landline. Landlines are always more reliable. It's one of the reasons why older generation homes always have a landline. The younger generations, they tend to discontinue their landline and only carry their cell phone. But there's a reason why landlines are reliable. So 988 is here for you. If you can't get through on your cell phone, or you don't have service, or it's a hit and miss messaging, because we do text as well, find a landline.
Right.
And remember that we've all been through this together, and together we need to help each other heal as a community. And so I ask the people of Guam to reach out to your neighbor, make sure there's not an elderly or somebody with a disability that might be needing help and just can't get the help. Be their eyes and their hands and their mouths for them. And as a community, we'll grow stronger. It's the right thing to do. It's what God would want us to do.
Right, and as you mentioned, a lot of people are expressing that they are feeling isolated.
Yes, loneliness is setting in.
Right, and as you mentioned, also reception is not so great right now.
Right.
So for those who don't have access to a phone or a landline, what are some practices or things that they can practice on their own to get through that?
So one of the things that we always push is because you're feeling anxious, your anxiety will build up. And so we have this very simple exercise called the breathing calming exercise. And very easily we can get all caught up, our mind and our loneliness. We can feel very isolated and feel like we can't get over this hump. So our minds can play tricks on us, so we need to calm ourselves down. A lot of people calm themselves through different ways. They pray. That's definitely something that I do. I pray, it calms me down, and prayers always help. Another strategy is breathing exercises. You need to calm yourself down. Tell yourself that everything is going to be okay. We got through major typhoons before. We got through COVID. We're going to get through this again, but we need to calm ourselves down. Breathing techniques. Breathe 5 seconds through your nose. Hold your breath for 5 seconds and release very slowly through your mouth. Do that 2 or 3 times and you'll see that your pressure and your stress will go down. And you're not going to hyperventilate because you're going to do it slowly. And so breathing and making sure that you hydrate and please eat well and stay away from drugs and alcohol during a time of adjustment like we're doing right now. That will all help in dealing with loneliness and anxiety and depression that naturally sets in natural disasters, post-natural disasters. Now, Guam Behavioral Health, besides 988, is we're still taking crisis walk-ins, crisis only. So, and I know the difficulty of probably getting to our department might be a challenge, but if you do, we're still available for crisis only. So we're in a crisis service mode right now. And of course, last but not least, if 988, you can always call 911 if you're really, really feeling alone, depressed, or just really, really in need of medical attention. Get the attention you need. We're gonna be fine. We're gonna get over this together. There are people like Guam Behavioral Health and Wellness Center, the hospital, government services that are open. We're here for you. We're just a little bit challenged because of Wi-Fi, cell, mobile connectivity is not as reliable as pre-typhoon. So 988 is here for you. You're not alone. We're here for you.
And then my last question for you, is there any chance that Guam Behavioral Health and Wellness Center will mobilize and get out there to the community and offer mental health support?
Absolutely, and we're doing that already in small blocks, small ways. One of our LINK program has connected with Public Health and Todu Guam to go out to subdivisions, at-risk subdivisions, for not just medical care, but mental health assessment. So we're doing that already. We're going to go to the shelters, and we're starting that very shortly. We're going to the shelters, making sure that the shelter folks, why do we begin at the shelter? Because those are the folks that are most displaced. They had to leave their home because they felt that their home, wherever they were staying, was not adequate enough. So they are feeling a separation of home and displacement already. So we're definitely going to be at the shelters, the typhoon shelters that has over 700 people still there. We're with Todu Guam and Public Health at risk communities. and at the shelters. And our clients, our direct service is reaching out, doing wellness calls, and visiting our clients at their homes if we can't get a hold of them. So already out there in our own way with our own clients, doing wellness checks and home visits if necessary.
Great. Well, thank you so much for providing that update, and a great sigh of relief for people who are in desperate need of that mental health support. So thank you, Director Arriola.
Thank you very much, and remember, you're not alone. 988 is the number to call.